Okay, so when we talk about immunotherapy, there's you can talk about different aspects. It's one of the major bases for our treatment because we know that a strong immune system gives you a much better chance and better capacity to resolve whether it's an infection or a tumor or even an abnormal inflammation. So immunotherapy goes everywhere from adequate immune stimulation to immune modulation and immune regulation, because you can have very little immune system or too much of an immune system. You can have an immune system that's not resolving, or you can have an immune system that's creating damage that it's overdoing it. You know, in the recent events, a lot of the patients, when they had viral infections like COVID, it wasn't the COVID itself that got them so sick, but rather the immune response, the exaggerated cytokine storm. So that's just an example of how the immune system can also be overreactive. So when we talk about immunotherapy, we talk about the different resources to balance it out. Now, having said that, we use different vaccines in regards to immunotherapy. When we have cancer patients or we have patients with a chronic infection or let's say Lyme disease or different other conditions, normally it's the lack of immune system response. So what we want to do is train the body and give different vaccinations or more biological treatments that will rebalance the immune system. Anywhere from dendritic cell therapy to LAC-NK therapy to even CAR T cell therapy. So we're using your own cells and retraining them and also incubating them and sensitizing them to whatever we need. When we talk about NK cells, we're talking about natural killer cells. These are cells that have the capacity to engulf, or phagocytize would be the adequate term, other cells that could be potentially malignant or that are already malignant. And when we have dendritic cells are what we call antigen-presenting cells. So these are the cells that tell your immune system who to attack. So because a lot of times people have a tumor, but their body doesn't recognize it at 100%. So we need to train the body so it can attack that tumor. So in both cases, we use your own cells, we extract them, we isolate it, we purify them, and then we take the abnormal cells from blood using what we call a CTC and train them. And once we've sensitized the cells, then we will incubate them and put growth factors for them to multiply and re-inject your own cells in a higher amount as a vaccine so your body can start now resolving and attacking the tumor. So if it's a matter of a virus, we do it against the virus, depending on each condition. So immunotherapy is a very important tool, and it's a very important basis. So, and we're very proud of all the work that has been done and the advancements in getting all this process done over the years. So, and the results that we've seen are just quite spectacular, because these are usually patients that did not have any possibility of defeating, and you're giving them a chance to basically resolve their condition.